So again, thank you for joining us today's meeting. We wanted to cover safe renovations, talk about safe renovations today. And as you can see on the agenda, we're going to talk about what's so important about home renovations, why now, who's most affected by renovation work and why. That'll be Karlos and Jenna. What types of renovations can be harmful? Nigel and Jenna will talk about that. What can I do to protect my family? Again, that's Nigel and Jenna. What types of training do certified contractors need before starting renovations? That's Jenna. And then last but not least, who can I reach out to for more information on lead poisoning prevention? That is all. A group discussion. And I believe Sarita has some poll questions that we can all participate in. So the first question is, have you or will you be doing home renovations soon? And, oh, I'm sorry. I think I was sharing that instead of. Do I need to stop sharing my screen? Okay.
Oh, wait a minute.
So while Sarita gets set up, we just wanted to start off with a poll question before Jenna and Karlos jump into the discussion. And I know we're getting used to running the polls.
Right, so I see everybody's doing the polls. They're all together, so you have to do them all at once as opposed to separate polls. But so we have 4 out of 8. So if you're gonna, and I know that, let me just see, this is going, oh, so I can't do the poll because I'm running it. So
Yeah, that's what I just realized. I can't do it either.
Yeah. So
what was the answer to the first question?
all right, well, I can end the polling first. If everybody's done, that's going to respond. So yes, 1 last minute. Okay, end the polling. So now I can share the results. Okay, so can y'all see these? How many people will be doing home renovations soon in this group? And what we have is about 40%. See, I would add myself and so would Shirley. So it would have been even more if we could have been in there, and Karlos too, somebody. So, and then have you done any of the other following recommendations during renovation? So I think we all know about covering the furniture with plastic, but in terms of the respirator or sealing off the room, that's something only a few of us have done. And this is a very educated group because nobody is in the never thought about it before yet. And then how many people, do you know anyone whose children who've been diagnosed or families dealing from the complications of lead poisoning? And so some of us have had that because of the work that we do. So thank you very much for doing these polls. And I'm going to stop sharing the results. Any comments, any thoughts about those poll results?
Good to know that we're all sort of in the educated category, knowing the risks and kind of taking advantage of ways to take precaution.
All right, great. So our first agenda topic today is what's so important about home renovations, why now, and who's most affected by renovation work and why. And we're hoping that Karlos and Jenna can share their thoughts about that, their stories that they have around about why it's so important right now during the pandemic.
Absolutely. Jenna, do you want to start or do you want me to
Sure,
start?
I can start with some general overviews. I think, Karlos, what will be really interesting is your perspective as somebody kind of working on the ground with the families. And getting to see maybe not so much in person, but even just like videos and pictures of these things and hearing, you know, those stories directly from the families that we're serving. So why now? So one, the pandemic, as everyone knows, a lot of people have been staying at home for a very long time. And for years and years and years, we've always said, homes are what poisons children. So lead paint in homes. And we can continue to say that with exclamation points. And a big reasoning is through some basic data that's come out for not just Massachusetts, but also through that New York Times article that was shown in Massachusetts, we can without a doubt say, yes, lead poisoning has increased during the pandemic. It's happening. The last 2 years, we've seen significant decreases on an annual basis in childhood lead poisoning. And we can see it's pretty significant. It's about 3% overall. It might be a little bit more when we talk about different age groups. We're especially seeing it with the 3 to 4-year-olds and even 5-year-olds. So most of the bulk of the cases that we have usually are between say 9 months and maybe 2.5. So we're actually seeing an increase in that older age group. And part of that is because kids weren't going to daycare, they were staying more at home. So we're kind of actually seeing what we've always kind of sort of known play out in real time. It is happening, it seems like across the whole entire United States, but we have some fairly decent data, and there will be, just so you guys know, a follow-up to that New York Times article. New York Times has put in some data requests, not just with the state of Massachusetts, but other CDC programs. So we will have updates on that. So why is it important? People are spending a lot of time at home. They have been. Also, not unfamiliar to a lot of us, people have been bored at times and doing a lot of home projects and keeping themselves occupied. And, whether you own your home or renters, we've definitely seen it, from both directions. People looking, for things to do, to touch up the paint here. Maybe it's a good time to replace the windows with some of that extra stimulus money. And with that, it's causing lead dust, which is still the primary cause of, exposure in childhood lead poisoning. It primarily affects kids under the age of 6, especially when kids start getting mobile. But also too, the renovators themselves, the adults, can also be impacted by it as well. And we're kind of seeing this sort of vacuum situation with people staying at home doing these projects. And also kids are still not at the same levels in terms of screening. So we still have a decrease in overall screening and more cases, which is pretty scary. I think for us at the state level, it's the first time that's happened in a while. And now we have, some solid evidence to why, in terms of renovations being a source. Renovations and home projects have always been, high on the radar with pretty much any childhood lead program in terms of exposure sources. I did some quick math in early January from cases March 15th through the end of 2020, and about 21% of those cases, so those are cases where there's children that are poisoned, there was a direct relationship to some sort of renovations that were happening in the home. So that was, I actually did some analysis on that, looking at both what community health workers and inspectors were saying, feedback they were getting from the parents, things that they were seeing. So that 21% is actually relatively normal from year to year. But now being able to kind of sort of quantify it, you can tell that it's a very significant piece of the equation. People taking these projects on either themselves, or sometimes they hire people, but they're not the right people. And, it often, unfortunately, leads to children getting exposed and poisoned. So it's definitely a very real thing with all the circumstances piled on top. And with, the screenings down, we are seeing more kids in Massachusetts being lead poisoned, unfortunately. And I'll leave it there unless you guys have some questions. I think Karlos can probably provide a lot more kind of that on the ground insight into what his families are seeing and experiencing.
Thank you, Jenna. And just to add to what Jenna's saying, she's right. It's 2020 was a crazy year that rocked us, right? And we're still kind of lingering, right, in 2021. But with that said, just to add to her point, a lot of families that I have spoken with are doing just that. They're taking this time, especially in the summer and the spring when the weather's warmer. An example last year, to remodel, to repaint, to do outside work. Sometimes we often forget, even in lead poisoning, that it's in the soil as well. So sometimes they're doing work on the exterior. And a lot of those loose paint chips will fall into the ground. Kids play outside, and then you add the hand-to-mouth component as well. So just to continue with that point, yes, there has been a lot of families, but we know that lead dust is is very dangerous and what have you to these kids, especially between the ages of 9 months and 6 years old. We know that it can affect their behaviors. Lead is poison, obviously, so it can affect their blood pressure, their kidney, their memories, can cause headaches as well. So a lot of these kids are being exposed to it. In my conversations with parents, it's due to a lot of hand to mouth behavior. And so it's just a lot of conversations, just reminding parents on how to do things safely. You know, limiting the amount of traffic going in and out the house. For example, you know, if I'm working on my kitchen, I want to limit, you know, who's going in there taping off the section or maybe covering off sections. And so a lot of these conversations are informing parents on how to do things safely, what tools they need to get it done safely, and also just reminding them of the hazards. You know, pregnant women, we forget about pregnant women as well. Maybe there's a pregnant wife in the household during the time of their significant other doing repairs that can also affect a mom who's pregnant as well. So a lot of these levels are coming up higher, and I think it's just because we think about lead poisoning, right? It sounds so dated and so what have you, but it's still so relevant to us, especially here in Massachusetts, where a lot of the homes were built prior to 1978, and they're old. The foundations of these homes, their walls, their paint, it just needs a lot of repair and what have you. And I think a lot of families certainly took advantage of this, right, during the pandemic. But we forget that one thing, that lead poisoning component. And I think because it's not something we really focus on anymore in 2020, which is kind of weird, especially with the education that I have received in this training and in being in this role, it's especially in this state, it is something very still prevalent. So we do a lot of education, a lot of reminders, and also offer services as well to any families. And I'm surprised, just even filling this role, I started in September. There's a lot of cases, a lot of cases. But again, it goes back to that remodeling. And then there's just also families as well who, you know, some cases who it's just that simple hand to mouth behavior. So maybe remodeling wasn't done, but you always want to have those reminder talks with people, with parents and what have you, and just give them the right tools that they need. Have these conversations with them about proper repairing and whatnot, and how to protect themselves. So it's very important now, especially now more than ever. And you know, we're still living in the lingering effects of 2020. We're still in this pandemic, even though there's vaccines or what have you. But people are still taking time out to do what they have to do for their homes. I spoke to a family today, uh, and one of the inspectors recently went, and I'm reading the notes, and so you know, I mentioned that a lot of these homes are falling apart. This was a home, perfect example. Loose paint on the walls, holes in the walls, dust everywhere, windowsills in the interior and exterior that have loose paint chips. And that's really scary because, you know, sometimes it's not just the child who's on my caseload or on our caseload, but it's also affecting, you know, it could affect their siblings. There might be other children in the home that come in and out or what have you. So it's always an important time to talk about this, and to really give people the proper tools and the proper education around it. I feel like there's so much more that I wanted to say. I was thinking about all these things before that, and now that I have the spotlight on, but is there anything I feel like I'm missing, Jenna? If you can back me up here a little bit.
No, I think you gave a good overview of what's happening, not just with the renovations, but in older homes in general. As they start wear and tear, and some of them are crumbling. So I think it just highlights at the end of the day that homes are still the primary source of exposure. So I think with this pandemic, it's just really elevated that, even higher, to your point. So thank you for that. That's helpful. I'm not in the field like I used to
Yeah.
be, so I don't see it in here as much, but it was really interesting kind of crunching, going through all those cases and seeing what some of the primary, at least what we thought were the potential causes for that exposure. So it sounds like it kind of is mirroring what I was seeing. So I'm glad to have that perspective.
Yeah. And also, you know what's something that just registered in my mind now? Um, right? Because so we talk a lot about, this is off topic or whatever, but even like racial inequities and what have you. And I'm noticing that a lot of families, um, and I don't want to just pinpoint it to one race or what have you, but a lot of families aren't really, or not a lot, some families aren't educated around this or as informed, So in talking to them, it's just like you feel like you're breathing fresh air into their right vast knowledge of home care and what have you, because they weren't thinking about these things. Sometimes I'll ask questions and they say, "Oh no, uh, my child doesn't do this, my child doesn't do that." But wait a minute, I painted earlier upstairs on the second floor about a year ago, or you know what? I noticed my child licking the wall. I know that sounds crazy, but these are conversations that I have with clients. They'll notice it afterwards, and then it's just like, oh, aha, that's where the risk might have came from. So even if you didn't renovate, there might be this other component. But yeah, just to conclude, there's so many older homes, especially Massachusetts, and just to add to Jenna's point again, everyone is taking the time out to do what they can now. This is the time, but we have to keep reminding people these are the warnings, these are the signs, and this is what can happen if things aren't done properly.
I have a question for the two of you. Are you finding that this is true for homeowners or renters or both? Is it more about an issue for homeowners or renters, or does it not matter?
For me, it's both, but for me, it's a lot of the homeowners are already informed around this. So renters, and especially a lot of renters, especially people, even like in my community, the Latino Hispanic community, if they're not so informed on these topics, man, I see like these levels really, really high, or even other cultured families. I feel like some of that information might not be out there or accessible to some people. So it's a combination of both.
Yeah, I would echo that. It's a combination of both. I think it comes down to the resources. Some of it's informational, some's not. I mean, I can tell you of many cases that we have where they're very affluent communities and very old homes, and someone just decided to do something really silly like sandblasting.
Yeah.
So it's not just one. Just wanted to put that out there. Even some of the most educated people are, sanding their stairs in their old leaded stairs and things of that nature. It's just that, like you said, it's that access to information and that resources and being able to sort of remediate it that becomes more difficult. Those are the families that can go out and go buy HEPA vacuum or have professional cleaners come in. Whereas those other families, I think, if they really have contaminated the place, they're in a really tough spot to help with that cleanup and kind of get them, move forward where they need to be. So it's definitely a thing across the board. I think it just hits those families a little bit harder that don't have those resources to help clean it up.
One of the great things, if I may add, that we're doing here at Square One, hopefully I can share this, Melissa, and stop me if you don't want me to, but I'm going to share, is we are going to be providing our families with these products and these things that they need, items that they need, cleaning products, brooms, mops, vacuums, dusting wipes, masks. And so I'm actually super excited about this because this gives us a chance to really create some aha moments for maybe families who don't have enough supplies, or it's just a really kind gesture. And also, putting little book bags for the children as well, with the kids' face mask and what have you, and things that they could utilize. But mostly it's for parents as well. We just ordered a bunch of mops and buckets and vacuums and cleaning wipes. And these are things that Melissa and I are probably going to be giving to our families very soon. And the goal is to get every family on my caseload these items. And you know what? Some of these families might have these. But how nice is it if I show up at your door and say, "Hey, Shirley, here's a vacuum, and here's a mop and all this stuff, and hey, I heard you were going to do remodeling, so here you go, man." This is the time where all of us, I don't care what your monetary status is, we're all in need of something. So just if I was a family receiving all these and then getting that conversation piece, that's an aha moment. That's a beautiful blessing. So the point is that Melissa and I will be delivering these items very soon to the families on my caseload, and then creating that conversation piece and helping out and doing what we can on our parts.
You said it, Karlos. We're excited about this opportunity for families.
Absolutely. It's kind of like that Oprah moment, you know, you get a car, you get a car, you get a car. Well, they get a vacuum, you get a vacuum. It's
So-
great. It's always great to help people.
Right.
Yes.
And so with that packet of when you give them those supplies, we have a new flyer that we've developed with all of your help. That is our do-it-yourself home renovation flyer. And I know this is going to be on our agenda as we talk through it, but this is exactly the kind of information that people need to prevent lead poisoning and to know what resources are available. So we're going to walk through this a little bit more, but I wanted to just highlight it right now where you're talking about as you give them those cleaning supplies, give them this information as well.
Yes, ma'am.
We can send a link to this and we'll be posting this on the website as well. And it will be in Spanish as well.
That's awesome.
If you need it in other languages, let me know. We can also get it translated.
Okay. Cool.
So Jenna and Carlos, thank you so much for sharing your stories. I was wondering now if we could talk about what types of renovations can be harmful, and if Nigel and Jenna can speak to that.
Yeah, so I think Nigel has a PowerPoint he wants to share. And then, you know, if there's anything I have to add, or I can certainly do that. So I think he's gonna share that with you.
Yes, thanks, Jenna. And I am clicking to share screen if I'd be allowed to do so. Let's make this the full screen and we'll do that. Is everyone able to see it?
Yep.
Is everyone able to see page 1 here? Looks
Yes.
as though it's going through. So I thought the slides might be useful because there's some specific information that just might be helpful to have a visual on. Not a lot of photographs or images, but the slides could be helpful just in terms of sharing some information. I'll try not to be repetitive because I think Karlos and Jenna shared some really good information, some of which is right here on this first slide. But one thing that I don't think was mentioned was the fact that there can be some punitive action if you've got some lead paint at your property that is not well maintained. So city code enforcement in Springfield can cite the property if there is items around the house that are in disrepair, particularly from the exterior that can be easily seen. And obviously if there's lead paint on the exterior of the home that's chipping or falling away, it falls right to that ground and it can easily be moved or tracked into children's play areas or, you know, onto property that's not even yours. So city code enforcement does have an eye out for that and can cite a property for lead paint that is not well maintained. The slide just sort of mentions that 1978 is what qualifies a home as quote unquote old. Springfield does have quite a lot of old homes, the city of homes, with so many of our housing stock being old. 1978 is sort of that cutoff point where houses since that time aren't allowed to have lead paint, but prior to that, many of them did. So that's the key date to pay attention to as you consider what you want to do at your home if the home is built before that. I want to start off really with some key considerations. In order to do work around the home and really be lead safe on any level, you've got to know where the lead paint is. And so in order to really have that, aside from some what would be anecdotal sort of visual evidence, looking at what the paint looks like and how it's chipping or how it's falling, that really is unreliable if you're not a trained expert. The way to really know where the lead paint is in your house is to have the home inspected by a licensed lead paint inspector. There are several of them around the state, a few right here in Western Mass that are reliable and have been in business for quite a while. Small companies, big companies, but you really want to know where is the lead paint around the house. And this is really the only way. It certainly is the only way that it be recognized by the state of Massachusetts. That comes with a caveat. once you get the home inspected, you now have that knowledge, which is great. You're also responsible for that knowledge. And so if you have anyone living in your home, or when you are ready to sell your home, that lead inspection is an official document that's on the record with the state and does need to be transferred over to a new owner. And risks need to be communicated to those who live in the house, especially if you are the owner occupant of a 2-family home and you have a tenant in the other unit. That tenant has rights for the knowledge of where that lead paint is, and certainly has rights around what they need to know if and when renovation is taking place around the house. Speaking of the renovation, we want you to consider using a contractor. We have this webinar is ongoing at the moment because we know that some people are taking the time to do work on their own. DIY is really popular. As Karlos mentioned, folks are at home and this is an opportunity to do that kind of thing. But we want folks to consider using a contractor. That's really the safest way of getting rid of the paint. The most reliable way to know where it is to get a licensed inspector. The most reliable way to get rid of it or to make it safe is to use a contractor. You can do some of the stuff on your own. There are different levels of de-leading and making lead safe renovations that I'll get into in just a little while. Most of the ways in which you want to do this and do it safe and do it in a recognized fashion does come with some training and some credentialing, and the training and credentialing might come with a cost. But again, that's the best way to do things safely. Lead paint is really highly regulated by the state and by the federal government. And there's good reason for that because of all the health implications that have already been outlined. You can learn a lot more about what is necessary, what's allowable, and what's advised from mass.gov. Department of Health as well as Department of Labor have important information around what you need to know for getting trained on lead paint or for doing some renovations on your own. Department of Health also keeps track of which homes have already been inspected. There's a lead paint database that you can access to find out whether or not your home already has an inspection. Hopefully you would know that, but if you don't, a lot of that information is on record. And I mean, one crucial thing, because I know one of the questions is how can you keep your family safe? If you're doing any DIY work, or if you've got a contractor, for sure, they'll let you know this. But certainly if you're doing the work on your own, you want to be sure that household members are out of the house when work is being conducted. Really, even small projects can create lead dust. Small projects can create lead chipped paint or other hazards. And the best way to avoid all of that is to be out of the house when all the work is being conducted, and actually not to return until it's really well cleaned up. And there's particular ways to do that cleaning that I can touch on a little bit later. There are several ways to do de-leading. And this is whether you are a licensed contractor or a DIY person. There's just certain ways to get lead paint either out of the home or to make a project or to make a space lead safe. So one way is scraping. Scraping is honestly, you're just taking a sharp metal tool and you're scraping the paint off of it until you get down to the bare wood or the bare material. In cases where maybe the design is too fine for that, you can take a piece off site and dip it into some chemical, and that will take the lead paint off. They'll return the item and hang it back up for you. This is usually a contractor who's going to do that. You're probably not going to do that yourself. You can cover it with aluminum or other material that will trap any lead paint that might be loose. Encapsulating means to paint over it with a really thick paint that just sort of tamps it down and doesn't allow the paint to chip off. And then you can remove components permanently and just replace them. You demo that area and replace it with something that looks similar. And the lead paint at that point is effectively removed because you've taken that component out of the house. And each one of these methods has varying levels of risk. There's low risk, moderate risk, and high risk work that can be done at a home. Scraping is always high risk because just imagine scraping a material, you're creating dust, you're creating just hazardous material that then goes into the air, and it can really be a problem. It'll fall to the ground as well, and creates a hazard that really is unavoidable. And the other pieces also have varying levels of risk, but these are primarily the ways that lead paint can be removed or made safe in the property. It's important to also know the difference between de-leading and lead-safe renovation. De-leading in Massachusetts is when you are aiming to get a letter of compliance with the Massachusetts lead law. And that letter of compliance would be attached to the lead inspection, indicating that the home is lead safe. And that letter of compliance, again, can be passed on to a new owner and be shared with tenants to have everyone comfortable with the knowledge that that space is lead safe. Lead safe renovation, different from de-leading, is when the purpose of the work is simply to do some home improvements. You're simply looking to do some home improvements. There may be lead paint connected to the work that you're trying to do, in which case you really still have to pay attention to it, and you've got to work with it in a really safe way. So just a couple examples of lead safe renovation jobs. They're plumbing and electrical, where you kind of have to cut through walls maybe to get to your pipes or get to your wires. If you want to replace your windows just to maybe have better energy efficiency, or if you have old windows that are broken, the molding around it would have potentially lead paint on there, or the walls that you have to cut through to get to the wiring and the plumbing might have lead paint connected to it. You want to use lead safe practices to do that work. Again, licensed contractors, credentialed contractors have the ability to do that, have the knowledge and the training to do that. If someone happens to be doing these things on their own, it's really critical to pay attention to doing these things in a safe way. Low risk work would include removing doors, replacing doors, covering some spaces as I outlined earlier. Vinyl siding on the outside, takes some skill to do that. But if you have confidence to do that kind of thing from a construction standpoint, those pieces can be low risk items to take care of. Encapsulation is also something that qualifies as low risk. Testing for encapsulation is using tape to figure out whether or not the paint is loose and will it come up easily and require or suggest encapsulation. Those are low risk activities. But even low risk activities require some attention to preparation, and even getting the state to look at your work ahead of time and afterwards. You want to review a lot of the literature that's available to you online. There's a test, a quiz that you should take to prove to yourself and to the state that you are knowledgeable and capable of doing some of this work in a safe way, and that you've seen the information that's important to have before you really start with that. And then there's an authorization number that CLPPP will issue before you can get started with doing the work. And then generally, as the work needs to be conducted, there's just a couple of sort of a simple way to think about doing the work as you're in the midst of it. You want to work smart, work wet, and work clean. Working smart means that you want to just do things in a way that will minimize the amount of dust or the amount of chipped paint that's then able to be spread around the home. So you want to lay down plastic as you're preparing to do the work. You want to wear protective equipment, personal protective equipment, PPE, that will keep the lead paint off of you. One of the ways in which some children get sick with lead poisoning is that contractors, sometimes de-leading contractors, often folks who are not credentialed for lead paint contracting, might do some work at a job site that involves lead paint, not using PPE properly, finishing their work and going home to their families, bringing lead paint dust with them on their clothes, playing then with their children, and then finding out some period of time later that their children have become sick. Having never gone to a place where there is active lead paint or de-leading going on, or exposed to lead paint in their home. A contractor or someone working with lead paint can bring that home, tracking it on their clothing. So that's why the PPE is so critical. And it obviously it keeps the contractors safe. Contractors themselves, I think this was mentioned, can get sick as well. And what lead paint does over time, if you're consistently working with it, even as an adult, lead can get in your bones. It affects children by going to their brain and affecting brain development, and obviously some physical ailments as well. But even grownups can have lead paint affect them physically as well. You begin to feel weighed down. You begin to feel a reduced range of movement, and it can affect you mentally. And so it's just so crucial to use PPE as you're working with anything that could involve lead paint. When it comes to working wet, it just helps to spread water. Use water with a spray bottle to just wet the area down. If you imagine it, that can be at least an aid in helping to reduce dust from going up in the air. It might turn maybe a little muddy, but it's better than dust in the air. And so that's one way to also help keep the workplace safe. I mentioned covering the floor with plastic. You also want to cover your furniture or other items around the home with plastic, putting away in another room or in a storage area, things that are loose, certainly things that kids might end up playing with later, toys and such. Get those away from the work area altogether. And then as far as working clean, you want to mop your area ahead of time, make sure that area is clean and free of contaminants. Use a HEPA vacuum as you're going along. A HEPA filter is just a stronger filter that's approved. It's federally approved to suck up these types of contaminants and get them out of the air and off of the workspace while you're doing it. And then mopping up and Swiffering and Clorox wiping your surfaces afterwards to really make sure that there's no dust remaining after the work is done. These are just a couple of links that would be helpful, mostly state-sponsored information on mass.gov. Mass Landlords also has some good information about the differences between de-leading and lead-safe renovation. If you've got tenants in your home, what some of the liabilities can be if you have tenants. And then there was a video produced by This Old House that I thought was pretty informative and had some good visuals that could sort of inform someone who was looking to do some of this work, just to give them a chance to see what some things look like. Obviously sharing my screen with this PowerPoint as it's available right now. The links are not active. You won't be able to click on these for the additional information that's online. But if the PowerPoint can be shared afterwards on the Healthy Homes website, you can access some of it there. Appreciate the time. I will hand back to Jenna. Hopefully I didn't take too much time, but if there are items that I might have missed in relation to this, certainly those things that are under Department of Health's purview and or things that I might have gotten wrong, I certainly defer to you to let me know or fill in some gaps or make any corrections.
Oh, thank you. So as you guys know, lead is very technical, and in Massachusetts, we have the State Department of Public Health, but also DLS also on the kind of the private contracting sector oversees some of this work at the same time. So it gets a little confusing. So I think with any project, first question is, if it's a home built before 1978 or like a child care facility, is to think what type of work are they doing and what's the purpose? Again, are they trying to beautify it or just repair something or improve it? Or are they really trying to de-lead something? Because when we talk about de-leading versus renovation, they're two very different things. Renovation is overseen by the State Department of Labor and Standards, and that's that lead safe renovator stuff that was mentioned by Nigel. When we talk about de-leading in Massachusetts, that falls under both purviews of the Department of Public Health and DLS, just to make it more confusing. And within that, there are some ways that you, as like a homeowner, can get trained to do certain de-leading work in categories. And I don't want to put too much information all at once because it gets a little bit confusing, but I think the nature of the work is super important. What is somebody looking to do? What they do is with the lead safe contractors is that you can get a full inspection if you want to, but what we recommend, and this is under the federal EPA rule, so lead safe renovator is actually Massachusetts equivalent of the federal EPA RRP role, which is just more confusion. So basically the state authorizes it and does its own training with that. And as Nigel pointed out, basically for the lead safe renovator is anyone that's going to come into contact with a set amount of paint. Usually it's 6 square feet or more inside, 20 square feet on the outside. They really need to have that certification, and those are paid contractors. People that do it yourself, kind of homeowners, people that may have been watching a little too much HGTV during the pandemic, do-it-yourselfers. That's where I think it gets, really, concerning at some points. And I think that wonderful guide that was created by Sarita's team is helpful to show folks that, yes, we would like you to hire a contractor, but we also understand that you might want to take this on yourself. And here's those resources. This is what you need to do in terms of preparation, in cleaning. And, related to that, Nigel, you mentioned that the Springfield Inspectional Services can cite for a loose paint. They also, too, if you decide to go outside and say start scraping paint on like a windy day with no protection, like no signage, no warnings, you can also get cited for that. You get a cease and desist letter. There's a few different departments that can issue that. So there is kind of a lot there. And I think it gets confusing even with the lead families. I'm sure Karlos, that he knows, is that a lot of times people don't understand all these differences, especially if they have a poisoned child. And then they start like trying to go out and get the test kits, at the hardware store. And while that's helpful and it's sometimes used for renovation, they'll test components. That's actually very common under the RRP and the lead safe renovators to test components individually versus hiring that private lead inspector. And one of the big reasons is if you pay and have a private lead inspection done like that, and then decide to do some renovations work, it could end up looking like and being unauthorized de-leading work. It's very hard for us to distinguish. So I try not to muddy it too much. And I think maybe I have to create a separate little mini guide of what the differences are and kind of the purviews. There's a lot of stuff that intersects. So I think at the end of the day, we just want to make sure people are being safe, have that information, and think before you scrape is really, I think, kind of my motto, is to have that information, and hopefully you don't end up in a situation, as one of Karlos's families or one of our other families that inadvertently, they poisoned their kids because they were, painting or scraping or doing some other project. So it is a little complicated in that world, but at the same time, a lot of those practices, those safe practices, are same across the board. Working wet, HEPA vacuuming, leaving the work area or the house, depending on the type of work. So I just don't want to give the green light to say everybody go out and start doing all this type of work, because that's not. it, but at the same time, if people are interested in whether it's renovating safely or deletting, there's certainly avenues on both sides where we can either training or at least give them some informational material so they can do it in a safe manner.
Great. Thank you, Jenna, and thank you, Nigel, for that. The explanation between de-leading and the lead safe renovations. We'll make sure that we include those slides with the webinar on Healthy Homes website, as well as the flyer that Sarita shared earlier on safe renovations. We do have 7 minutes left, and I just wanted to see if, just to recap, if each one of you can just briefly explain like what, again, what your role is and at your organization, and how people can get in contact with you if they should need more information.
The city of Springfield, through the Department of Housing and Urban Development from the federal government, is in receipt of tremendous amount of grant funding to share with homeowners to do some of these repairs around their homes, in many cases for free. The programs that we have here, including our Healthy Homes program and our lead-based paint hazard reduction program, they are income eligible programs. And so you would have to, as a homeowner, as a household leader, you would have to show income eligibility per HUD and federal government guidelines for low income families. But if you can show and prove some of those details, and for the lead program, if you have a child in your home under the age of 6, you can get full de-leading work done at your home for more or less for free. And I say more or less only because there is a 25% of the cost lien on your home if you're an investment owner. But if you're an owner occupant, you can get 100% of the costs, including the inspection, covered by the City of Springfield Office of Housing. We will start off the project with a home inspection to find out basically where the lead paint is around the home, how much of it is there is. If there's a little bit, we can help you take care of it. If there's a lot, we can help you take care of it. If there's a tremendous amount, we might need to ask HUD for a special approval, but we may be able to take care of it even after that. So it's really critical that you look into opportunities to get some of this work, to get your home safe, paid for by government agencies or community agencies. And I specify the difference there because the City of Springfield being a government agency, we can do some of the work the way I outlined. I should specify also that our Healthy Homes program is specific to 2 neighborhoods here in Springfield, 6 Corners in Memorial Square. The lead paint program is available citywide for homes with children under the age of 6. But that's what the city government can provide. It's a terrific benefit for low-income families, but there are other benefits around the city as well. And I hope that I'm not stepping out of bounds here, but I would love to pass it off to our colleague Araceli to highlight what's available through Wayfinders and the Get the Lead Out program that Wayfinders sponsors.
Thank you. Here at Wayfinders, we administer the Get the Lead Out loan for mass housing. It's a little bit different than the cities. You don't have to have a child under 6. If you just want to do preventative work, you can apply for Get the Lead Out. Unfortunately, we do not assist with locating contractors. We can give you a list, but it would be on the homeowner to find and select a contractor who is licensed. We do the financing piece of it. It's not restricted to anywhere within the city. It's pretty much covers anywhere in Massachusetts. The income levels are a little bit higher as well. So that's just a little bit about the Get the Lead Out. Any questions? And if someone wanted to apply, they can actually reach out to me, email me, but I would transfer it to, we have 2 individuals who are currently processing get the let out applications. We have seen an uptick in individuals requesting applications. It seems that, you know, people are home with their kids. So it seems like we're this last month, like just last week, I think I sent out about 5 applications for individuals who said they had children at home who have tested now and have high lead levels.
I'm glad to hear that. That's great that people are utilizing that program. And, you know, through the Massachusetts Department of Public Health, we're a really good for information resource, not only online, but we do have a hotline that people can call us. So if they have questions about, you know, what's renovating versus still letting, you know, if you get yourself in a circumstance where your child may have been exposed, we can talk you through all of that in different options. Also to, who will call us for complaints if somebody's doing some unauthorized work or some unsafe renovations too. We're also kind of that repository for anything related to lead. And the best way to contact us would be through the online, either online, or we do have that hotline, and the hotline is 800-532-9571.
I'll go next. Again, community health worker for Springfield Square One, Karlos Reyes. Sorry. For Springfield Square One, and also for the CLIP program. And you know, you can reach me if there's any questions or concerns or what have you. 413-209-7608.